Good morning, everybody. It is time for the Orthopedic Minute with our friends from DMOS. And joining us in studio right now, Jackie, is a physician assistant. Her name is Lindsay Angbers, and she is here to tell us all about what a physician assistant does, because a lot of times you go to the doctor and that is who you see.
Absolutely. So good morning. Thank you for joining us today. And you are a physician assistant. So what exactly do you do on a regular basis?
Yeah, so I'm a physician assistant. I actually provide medicine to patients alongside a collaborating physician. I do everything from rooming a patient, seeing them and taking a history, physical exam, and then also being a part of a surgical subspecialty. I do assist with surgery.
Oh, you do assist with surgery?
I do,
How
yes.
about that? What made you want to become a physician assistant?
Yeah, so growing up in a small town, we didn't have a lot of access to physicians, and so it was really easy to get in to see the physician assistant more regularly. Also take into account the fact that you don't have to go to school for years and years on end. It's a quicker way to practice medicine, but also kind of fits into our lifestyle a little bit better.
So what kind of patients would you see on a regular basis?
Yeah, so right now I see patients age 0 to 100 years old.
Right.
Because I'm an orthopedic specialty, I do see patients that have injuries, chronic conditions that involve the musculoskeletal system. But previously I was a different specialty, so I also saw patients in that specialty. Physician assistants are everywhere from primary care to very specific up to surgical specialties.
Now, you said you were in a smaller town that didn't have access to physicians on a regular basis,
Yeah.
but physician's assistants, why was that the case?
Yeah, so in smaller communities, you just don't have the number of physicians that you do like in the greater metro area. And so in order to serve patients better, physician assistants are utilized as extensions of the providers. And so that's been great for Iowa and across the nation to just give patients better access.
Now, you mentioned medicine, too.
Yeah.
Now, you able to dispense medicine, or is it via a doctor?
No, so I have a DEA license. I prescribe medication
You do?
every day. I do.
Really?
Yes, yes.
Let's go back to your education for a second,
Yeah.
because you mentioned being a PA, you don't have as extensive of a time in school
Yes.
to get to be a physician. But what are the educational requirements to be a PA?
Yes, so I have an undergraduate degree in athletic training and biology. Most students who are pursuing a PA degree pick something along the biology or pre-med route.
Right.
And so I did that. Then I went to Des Moines University, where I received my physician assistant Master's of Science. And so most PAs in the U.S. have a Master's of Science, if not a doctorate.
How about that?
Yeah.
And is there any particular reason why someone should see a PA as opposed to seeing a doctor?
Yeah, so shout out to all my physician assistants. You know, we do take extra time to go above and beyond to not only manage the patient's condition diagnosis at hand, but also we can kind of take a few extra minutes to discuss what does that diagnosis mean for you as a person, as a work status, as family care, the care that you're going to need moving forward, how to get medication. You know, we can actually take a few extra minutes to maybe discuss some of that.
As I say, it sounds like it's more hands-on with a team of people working with you, so if they are really in touch with what's happening with you, so they probably have a great understanding of what's happening on a regular basis.
Yep, so I do like to say that physician assistants are the ultimate team player. You know, we work directly with our physician, and so we're trying to be an extension of them. They can't be everywhere at once, and so as a PA, if we can step in and offer support quickly to our patients, that is our ultimate goal. Also, we do pride ourselves in just being able to communicate effectively and quickly with medical assistants, with nurses, and again with patient navigators, receptionists, people taking phone calls, triage. You know, we are kind of that go-to between everybody, trying to get patients access quicker.
Now, how is your patient load compared to what a doctor's patient load is?
Yeah, so my current employment with Dr. Butler of DMOS is we see most of our patients together as a team. I work beside him all day, every day. Not that I don't see my own patients in between there, but ideally every patient that comes in our door is taken care of by both he and myself.
Okay.
And so that way, if you call, have a simple question, I can get a call or a message back to you rather quickly, whereas he might be seeing some other patients or might be stuck in a surgery. In between those surgeries, I'm able to access some messages, get some paperwork accomplished, and try to help people a little quicker.
So a PA would be the contact in case you're not feeling good. And how many times have you done this, especially this time of year? You call the doctor's office, say, I'm not feeling good, this is what I'm going through, you'd be the person that would handle that.
Yes, and so I do think with medicine we need quicker access for our patients. We do need patients' opportunities to be seen. You know, right now we can't make an appointment and be seen in 7 to 10 days for various conditions. And so a PA can actually intervene quicker. We often have a few more appointment availabilities, maybe a few more opportunities before or after work or school to see patients. And a lot of things don't honestly need a surgeon, or you don't necessarily have to see the physician. A PA is able to screen you for what is emergent, urgent, not urgent, and we can help you along the way.
Since this is the Orthopedic Minute and that's your specialty and expertise, why would it be important for someone to search out the advice of an orthopedic surgeon?
Yeah, so as physician assistants, we can diagnose and treat most any condition. Ultimately, when surgery is needed, we can be the first one to say, you know what, I think we're at this point where surgery might be the best option for you. Or in an acute setting with an emergent injury or condition, you know, often we're the ones that can look at the x-rays first and determine, yeah, this definitely needs surgical intervention. Let's get you in right away.
Right, so this is the first stage of getting that done. With your sports background, being focused on that, that's really more important, especially in this day and age, with everybody involved in sports.
Exactly. So I did an undergraduate degree in athletic training, and so that gave me my kind of first taste of orthopedics and also musculoskeletal system, and I really enjoyed it. I like working with an active population, but I also really like working with people who want to stay active, who want to continue to do things that they enjoy, especially in a pain-free life. So.
Absolutely.
That is awesome.
All right. A shout out to our PAs out there and all the hard work you're doing as a team to make us healthy on a regular basis. Lindsay, thank you so much for telling us a little bit more about what it means to be a PA this morning.
Thank you.
All right. And if you need anything done, you need any work like this whatsoever, DMOS is the place to turn to.